Welcome to Saskatchewan, a newcomer's guide to Saskatchewan healthcare. As a newcomer to Saskatchewan, you have access to a publicly funded healthcare system that provides medical care at no cost to you, called Saskatchewan Health. Saskatchewan Health covers all medically necessary services provided by physicians. Applying for a health card is the first step in getting provincial medical coverage. A Saskatchewan Health Services card, or health card, is a personal identification card you present for health services. Health cards are available for Saskatchewan residents and are issued through eHealth Saskatchewan. There is a 3-month waiting period from the day of arriving in Saskatchewan to obtain a health card. To cover you during this waiting period, you can get private health insurance from benefits providers like Saskatchewan Blue Cross. If you have landed in Saskatchewan as a refugee, interim health benefits cover you during this waiting period. The quickest and easiest way to get a health card is to use the online service, though it is still possible to apply with a paper form. To apply for a health card, you will need to provide immigration documents showing your status in Canada and proof of Saskatchewan residency. A lease agreement or utility bill often proves proof of Saskatchewan residency. Immigration documents you can use include a permanent resident card, work permit, study permit or refugee card or status, foreign passport with immigration stamp, or a temporary resident permit. Residency documents that you can use include a signed mortgage, rental, or lease agreement, utility bill such as home telephone, cable TV, satellite TV, water, gas, or energy, insurance policy like home, tenant, or auto, Saskatchewan motor vehicle registration, employer record such as a pay stub or letter from your employer on company letterhead, an income tax assessment, property tax bill, school, college, or university report card or transcript, statement of employment insurance benefits paid, statement of old age security T4A, or statement of Canada Pension Plan benefits T4A, Canada Pension Plan statement of contributions, or a child tax benefit statement. Your Saskatchewan health card fully covers all medically necessary services provided by physicians, including inpatient and outpatient services. This includes physiotherapy or occupational therapy, screening mammography for women aged 50 to 69, immunization services, sexually transmitted infections treatment, human immunodeficiency virus testing, services for treating alcohol and drug abuse problems, mental health services, problem gambling services, family health benefits, and supplementary health services. This program provides select additional health services to people recommended by social services. Saskatchewan Health will cover certain dental services, prescription drugs, medical supplies and appliances, optical services, podiatry or chiropody services, and emergency medical transportation costs. Saskatchewan Health will mail you a letter if social services assesses you as being eligible to receive these benefits. Saskatchewan Healthcare provides many healthcare benefits for free. However, there are certain services that are only partially covered, meaning you will have to pay out of pocket. Fees from services such as ambulance rides, vision care, dental, and prescriptions can add up. Air ambulance services. Patients with valid health services cards are charged a flat fee of $465 per trip, while third-party insurers and out-of-province residents are charged per flown mile. Senior citizens ambulance assistance. Eligible Saskatchewan seniors age 65 and over pay a maximum of $135 per trip for ground ambulance services within the province, and interfacility transfers within the province are fully covered. Long-term care. The Saskatchewan Health Authority covers a major portion of the cost of long-term care in special care homes or nursing homes, health centers, and hospitals. However, each resident also pays a resident charge based on income. Home care. This includes case management and assessment, home nursing, and physical and occupational therapy services. A fee covers part of the cost of the following services based on a person's income and the amount of services they receive, such as homemaking, personal care, respite and home management services, meals, and home maintenance. Private home care services and nursing agencies are not covered. Dental services. Routine dental services are not covered. However, the following are covered. Limited oral surgery procedures required to treat certain conditions that may be caused by accidents, infection, or congenital problems. Limited orthodontic services for cleft palate when referred by a physician or dentist. Extractions of teeth in limited circumstances, such as when medically required before undertaking certain surgical procedures related to the heart, chronic renal disease, head or neck cancer, total joint replacement by prosthesis, stem cell transplants, and within 15 years of specific cancer radiation treatment where recommendations from the radiation oncologist and dentist have been followed. Dental implants are covered in exceptional situations where no other treatment method is appropriate. Coverage is limited to circumstances related to tumors and congenital defects, such as cleft palate and metabolic disorders. To qualify for coverage, a specialist in oral maxillofacial surgery must submit a written request for prior approval from the Ministry of Health. The specialist must include detailed information and rationale to support the request. Coverage is limited to the initial cost of providing dental implants and does not extend to ongoing maintenance costs. Dental implants for trauma, post-surgical temporomandibular joint disorder or TMJ, or cosmetic purposes will not be covered. Optometric services. An annual eye exam is covered for all individuals under 18 years of age, all individuals with a confirmed diagnosis of type 1 or type 2 diabetes, noting that routine follow-up exams are not covered. Ocular emergencies, including injury to the eyes or a foreign body in the eye, noting that follow-up exams are covered for ocular urgencies and emergencies. Prescription drugs. The drug plan provides coverage to eligible Saskatchewan residents for listed drugs prescribed outside Saskatchewan hospitals. You are eligible for drug coverage if you receive supplementary health program benefits, receive special benefits from the Saskatchewan Aids to Independent Living or SAIL program, where coverage is limited to people registered with SAIL's paraplegia, cystic fibrosis, or end-stage renal disease programs, and qualify for palliative care. Saskatchewan Aids to Independent Living or SAIL program. Saskatchewan residents with long-term physical disability may be eligible to receive services, equipment, and supplies from the SAIL program, including free loan of mobility aids such as wheelchairs and walkers, and other aids such as hospital beds and transfer assists, financial assistance for home oxygen and aerosol therapy, artificial limbs and braces, and aids including magnifiers, talking book machines, and braille watches. A personal health plan from Saskatchewan Blue Cross can help cover these costs. Our affordable health benefits plans can be customized for individuals, couples, and families. Our plans include visitors to Canada. If you are waiting for your Saskatchewan health card, this is a good plan for you. This plan covers emergency medical expenses for newcomers and visitors to Canada. Coverage is available in 3 amounts: $50,000, $100,000, or $150,000. A Saskatchewan health card is not required. Blue Choice Plan. You can get customized health coverage with optional benefits to make sure your plan fits you perfectly. The Blue Choice Plan offers comprehensive, affordable coverage with a medical questionnaire required. A Saskatchewan health card is also required for this plan. Guaranteed Acceptance offers total health coverage with core health benefits, prescription drugs, dental, and VIP travel. You will receive guaranteed coverage with no waiting period and no medical questionnaire. A Saskatchewan health card is required for this plan. We understand that some newcomers have questions, such as what is a social insurance number? To work in Canada or access government programs and benefits, you need a 9-digit number known as a social insurance number, or SIN. Your SIN number is private and it is illegal for anyone else to use it. You are responsible for protecting your SIN. Applications for SIN numbers can be made online at Employment and Social Development Canada. All newcomers to Canada who are permanent residents or temporary residents who are eligible to work or study in Canada should apply to get a social insurance number, or SIN. To apply for a SIN, you will need to provide a copy of your immigration document, such as a work permit, study permit, permanent resident card, or confirmation of permanent residence if you've been in Canada for less than 1 year. You will also need a piece of Canadian government-issued ID, like a driver's license or Saskatchewan identity card. You can apply either online or in person at a Service Canada Centre. What is a Saskatchewan Identification Document, or SID? A Saskatchewan Identification Document, or SID, is a photo ID card that is available for all Saskatchewan non-drivers at any motor license issuer. Any SGI can issue this photo ID card free of charge to Saskatchewan non-drivers. You must apply in person at any motor license issuer. You will need to provide 2 pieces of original identification. One of these will be an immigration document proving your status in Canada, and the other will be government-issued identification from your home country, showing your full name and date of birth. You will also need 2 pieces of documentation proving your Saskatchewan residency. Most often, these would be a lease agreement and a utility statement. How to find a doctor. Finding a doctor can be very difficult, and for many newcomers, they may need to rely on the services of walk-in medical clinics until they can find a family physician accepting new patients. Newly arrived refugees, including privately sponsored refugees in Saskatoon, are eligible for services through the Refugee Engagement and Community Health REACH Clinic. To access this special service, they should contact Global Gathering Place at 306-343-9180. How to get a referral to a specialist. Unlike in many other countries, referrals to a specialist must come from your family doctor, walk-in clinic, or nurse practitioner. Referrals can take weeks, months, and, in some cases, even years. You will usually receive a letter from the specialist in the mail advising you of your appointment. If you are referred to a specialist, watch for this letter and ensure you do not miss your appointment. Sometimes you will be moved back to the bottom of the waiting list if you miss an appointment. Levels of care. Residents of Saskatchewan are fortunate to be able to access health services for free when needed. To ensure the most efficient service, it is important to access the correct level of care. Pharmacists in Saskatchewan can do much more than dispense medication. Pharmacists can prescribe medication for minor ailments, renew prescriptions, provide emergency refills, administer vaccines, and change the dosage or formulation of your prescriptions if needed. There is usually never a waiting period to see a pharmacist, and they are easy to locate in most grocery stores and pharmacies. Your family doctor is the best person to go to for most of your medical concerns. You will need to book an appointment to see your doctor. Appointments are sometimes booked weeks or months in advance. If your condition is urgent, call your doctor's office and ask if your doctor can see you immediately. You may need to visit a walk-in clinic if your doctor cannot see you. Walk-in medical clinics are best for urgent but non-life-threatening injuries or issues. You will be able to discuss your problem with a doctor and receive referrals or prescriptions as needed. Some walk-in clinics also have access to diagnostic services like lab and X-ray equipment. The hospital emergency room is the best choice if you have a life-threatening injury or urgent condition. Emergency rooms triage patients based on the severity of their condition, meaning you can expect to wait several hours before being seen if you go to the hospital for a non-urgent condition. Patients with life-threatening conditions will be seen immediately. If you cannot get to the hospital on your own and if your condition appears to be life-threatening, don't wait. Call 911. Even if you cannot speak English, an ambulance will be dispatched with help reaching you in minutes. It is important to note, however, that emergency services like ambulances are not free and you will likely be billed. Each trip costs around $250 or more. Can I ask for a different doctor? Yes, you can always ask for a different doctor. However, it is important to note that it is not always possible and there are certain situations where you need to be prepared to work with a doctor who is assigned to you. For example, specialists. It can be difficult to get referrals for specialists, and depending on the field of specialty, there may not be other options. Physicians seeing patients at the emergency department of hospitals and walk-in clinics without a pre-booked appointment are unlikely to provide you with a different doctor. Birth and delivery. This will depend on which provider is on call for obstetrics. There is a good chance that you will not be able to find a doctor who can speak your native language. You can always ask the clinic you are getting treatment from if they have any doctors who speak your language taking patients. If you are receiving service at a hospital, you can request an interpreter and one should be provided to you at no cost. However, most private clinics and specialist services do not offer interpretation services. You may need to bring your own interpreter. This could be a family member or a friend, a settlement agency representative, or arrange to pay for a professional interpreter. This is something that you will need to organize yourself. Ambulance trips are not insured by the government in Saskatchewan. Many residents in Saskatchewan purchase additional health insurance to help pay for ambulance fees. Newly arrived refugees who are not covered under the interim federal health program and those enrolled in Saskatchewan Assured Income for Disability or Saskatchewan Income Support and are covered under supplementary health benefits may not have to pay for an ambulance. Ambulance services can be expensive, with costs varying depending on distance and the medical services provided. You will be responsible for organizing transportation to attend your appointments. If you do not have a vehicle and are not within walking distance, you can call a taxi or take the bus. If you have a disability, you may be eligible for Access Transit Service, which can, in certain cases and strictly by appointment, pick you up and drop you off at your appointments. Newcomer organizations and settlement agencies offer educational sessions on various health topics and can help you understand and navigate the local healthcare system effectively. They may be able to help with access to interpretation services and can sometimes provide referrals to healthcare services. Newcomer organizations will also assist with understanding health rights and advocate for your needs within the healthcare system.